All right, let's continue then with one of our stories that we are tracking today. Of course, the UNAIDS today launched its 2025 Global AIDS Update, AIDS Crisis and the Power to Transform, which shows that a historic funding crisis is threatening to unravel decades of progress unless countries can make radical shifts to HIV program aid funding. For more on this, let's now speak to Monwabisi Mbasa, Provincial Chairperson of Gauteng for Treatment Action Campaign. Monwabisi, thank you so much for your patience and your time on the program. So while there has been great strides in HIV treatment, especially in South Africa, as we've seen in that report, we do note, of course, that these gains are threatened by donor cuts. The Department of Health here in South Africa says measures are in place to close the funding gap. I mean, you drive many community-led programs as the TAC. How is South Africa affected by aid cuts?
No, thank you very much, Unati, and thank you so much for having us on your program. And we would like to send our deepest condolences to the Mabuza family following the passing of the former deputy president. Unati, we have noted strides that have been made. If you look in the past 24 years, we were able to minimize the number of new infections and now increasing the number of people that were actually diagnosed with HIV, linking them to care, to ARVs as well. But now following this particular card, we have now seen a serious regress, and now this is actually threatening even the progress that we're actually proud about. Now, just to give you a bit of background to this, around 2010, we saw people living with HIV being linked on treatment were amounting to 1.4 million. And in 2024, in December, we were sitting at 6.3 million. And now in January, that number is beginning to decline, and that's a serious concern. And that equally affects now the capacity to provide these services, to people that need them the most. That's where the challenge is. Maybe we can proceed to say some of the challenges that we see now is that the human resource has depleted, the infrastructure is beginning to deplete, of which has not been in good shape for the longest time now. We're beginning to see overcrowding as well. And these are the challenges that actually gives Treatment Action Campaign a sleepless night, Unati.
Absolutely. I want you to just talk to us about the targets here and where we are as South Africa. We know, of course, that the global HIV targets are 95, 95, 95, and that speaks to 95% of all people living with HIV will know their status. 95% of all people with diagnosed HIV infection will receive sustained anti-retroviral therapy. 95% of people receiving anti-retroviral therapy will have viral suppression. In South Africa at the moment, we're sitting at 96%, in fact, and 79% and 93%. Just speak to us about also, in terms of those targets, how are we faring in the country?
We've been doing well in terms of first 95. With second 95, we've been struggling before the advent of these funding cuts, and then including with third 95. That's where the biggest headache was. But now, if you follow the trends, in February, we were launching, the Minister of Health was launching a program known as 1.1 million Close the Gap. So meaning that we are now seeing leakages from those particular strides as well. Now we are moving with speed, working with government and private sector to ensure that we are able to find that 1.1 million people who know their HIV status but who are currently not on treatment. In fact, we're on treatment, decided to disengage based on the known structural and systematic challenges. That's where we are right now. And maybe to put this interesting point, we are now making strides in terms of finding those people. About 520,000 people have been found. But unfortunately, over 60% of that number has actually, fallen through the cracks as well. So that's where the problem is right now.
Now, there is this new drug, I would imagine, Health Minister Dr. Aaron Motsoaledi hoping that this new drug, Lenacap, can help end HIV/AIDS in South Africa amid these cuts. Speak to us about what we know about this current drug. Is it a question of it being too expensive, thereby preventing access to most South Africans?
Quite correct. That will be a game changer when it comes to HIV prevention. As part of pre-exposure prophylaxis mechanism, the Lenacap. However, at the current pricing as we speak, it will be out of reach to the vast majority of South Africans because they couldn't afford. We all know that about 86% of the population is subjected to the less funded public health care. So meaning that this drug, even if SABRA was to actually sign it to law or approve it, but at the current price tag, it will be extremely difficult for vast majority of people that need it the most to be able to access it. That will be the problem. But however, it is indeed, scientifically, it has been proven that can be actually, a silver bullet to address some of our challenges when it comes to HIV response, particularly on prevention.
In terms of, given the funding cuts, one of the concerns was that some of the funds actually are there for salaries of some of these aid workers. How has that affected them? And I mean, what are the interventions in the interim, particularly given the sensitive time?
Okay, so now what has been happening here, through that particular gap, government has been continuing to fund HIV and TB, programs, right, including the procurement of, ARVs. But now where the problem is that after that budget card, we've seen an upward of 15,000 healthcare workers losing their jobs. That depleted the capacity to be able to respond to these pandemics. And then second to that, if you continue to have a bloated wage bill rather than having sufficient money that you are investing on programs or rather on service delivery, particularly healthcare service delivery, that is almost like a non-starter. So all we need in this regard is for government to seek additional funds that will be able to replace the funding cuts that we've actually suffered. How much do we need? We need about $710 million to $1.5 billion to bridge that particular gap. Then in that regard, we can therefore say we are sailing smoothly towards the goal of 2030. But at the current disjuncture, there's very minimal interventions that cannot even amount to the fraction that we're talking about of the shortfall.
All right, Monwabisi, thank you so much for your time. Really do appreciate it.